Hello, I'm Dr. Eric Lee. My main research interest is in hyperpressure or hypertension. Blood pressure by itself is actually a normal phenomenon. When the heart is beating, it generates blood pressure and then it sends the essential oxygen and nutrients throughout the body. So it's essential for us to live. However, when the blood pressure becomes too high, then it can damage the blood pressure walls and then cause damage. If you cause damage to the heart vessels, then you have heart attacks, heart failure. If you have this damage to our brain arteries, then you have strokes. If you have damage to the kidney arteries, then you have renal failure, kidney failure. More importantly, hyperpressure do not have any symptoms. So if you do not measure it regularly, you will not be able to pick it up. When we measure blood pressure in the clinics, if the systolic blood pressure, the upper value is more than 140, or the lower reading is higher than 90, then it's a hyperpressure. At home or out of the doctor's office, if you have upper pressure, the systolic pressure more than 135, or the diastolic blood pressure, the lower blood pressure more than 85, then it's already classified as hyperpressure or hypertension. So this question is actually tricky because it depends on the level of blood pressure. So if your blood pressure is only slightly high, so let's say your target is 135 while your blood pressure is 137, for example, then it's possible that you can just being treated by lifestyle modification. However, if your blood pressure is quite high, what we say stage 2 hypertension, or your blood pressure is more than 160 for the systolic blood pressure, it's very unlikely that only lifestyle modification will help you to reach the target, let's say 135. So in those patients, medication may be needed at an earlier stage. In the Hong Kong guidelines, we said that if the patient has only mildly raised the blood pressure, we allow the patient to have 6 months of lifestyle modification before considering of medications. While for higher blood pressure, like 180 or so, we treat them within a few weeks. Actually, lifestyle modification is very important for blood pressure management because we know, for example, if you have good exercise, if you have good diet habits, you can decrease your blood pressure by about 5 to 10 millimeter mercury for the systolic blood pressure. So it's almost identical to an effect of a drug. So I would advise patients with hyperpressure to have low-salt diets with a lot of vegetables, do a lot of exercises, especially the aerobic exercise like running, swimming, keep a good body weight, so not underweight, not overweight. And if you are smoking and drinking, quit smoking and at most moderately use alcohol. That would be very important for your blood pressure management. I think it's very important to emphasize that most antihypertensive drugs are very well tolerated and most people taking them do not suffer from any side effects at all. However, for individual drugs, about 10% of people may have some side effects, but it's also good to know that there's 3 to 4 groups of major drugs. So if you have problem with one kind of drug, there's always a choice to switch to another one. As a matter of fact, it doesn't affect your life at all. Studies have shown that some of the drugs can actually improve your exercise tolerance, can decrease your chance of stroke, decrease your chances for having kidney problems or death. So when it's prescribed by a doctor, it's good to take them. But in case, in a very minority of cases with any side effects, it's good to tell your doctor and perhaps to switch to another medication. Yeah, when my patient asks me this question, usually what they're thinking is that the blood pressure drugs is addictive or cause dependency, and that's why they cannot stop the drugs. But that's not true because the blood pressure drug only reduce your BP when you blood pressure when you take them. When you don't take them, they go back to the original level. There's no dependency as such. But usually, once we start the medication, it's very difficult to stop because blood pressure raise with age. So let's say if at age 40 you need the medication, it's very unlikely that at age 50 suddenly you can take off all the medication. And that's why usually the treatment is lifelong, not because of the drug itself, but because as you age, your blood pressure usually gets higher. as we spoke in the last question, so when you take the blood pressure drug, it drops certain level, and you don't take it, it goes back usually to the original level. So what happens when your BP is normal? So it depends on what you say is normal. So when you take the medication, if you go to like say 120 something is actually the perfect BP, the treatment target, there's no way you want to stop that, because when you stop it, it goes back to the hyperpressure level, right? But in some patients, they are very sensitive to drug. So once they take the medication at the usual dose, the blood pressure becomes 100 something or 90 something for the systolic blood pressure, then your doctors may actually decrease the dose, right? Because it's too low. So I would say when the BP is just normal, we don't usually stop the treatment, because we know that once we stop, it becomes a dangerous hyperpressure. But if it really gets too low, it may be beneficial to stop or decrease the medication. I think it's also important to emphasize that it's better for patients not to change the medications by themselves, because I have come across patients who only take their medication when their home blood pressure is high, and then when it's normal, they just omit the medication. But what happens is when you take the medication, it drops, and then you omit the medication, blood pressure raises, and there's a big fluctuation. And we know that the big fluctuation by itself can cause stroke and heart attacks. So it's not beneficial for your health. And I have also come across patients coming from other countries. When they're at their home country, they got their hyperpressure treated. But once they move to another country, it's quite common for them to just let go of all the medications. But usually the blood pressure will rise back to a dangerous level and can cause stroke, heart attacks, kidney problem. So I advise against that. And if in any doubts, it's better to have a regular doctor for follow-up. So it's important to remember that it takes time for the doctor to adjust the drug. For most patients, usually you may require 2 drugs to fully control your blood pressure, so it takes time. What you can do is to measure your blood pressure regularly at home. If it raised to a dangerously high level, what we say, the systolic blood pressure more than 180 or the diastolic blood pressure more than 120, you need to seek medical help early. If it's a little bit high and it's not yet hitting the target, you may keep on monitoring. Maybe after a few weeks it's still high, then you can go back to your doctor early for adjustment of your medications.